called androgenetic alopecia, and it is the most common form of hair loss in men. Alopecia is the medical name for hair loss, and androgenetic refers to hormones like testosterone. There are other forms of hair loss, but they have very different patterns. For example, iron deficiency can lead to general thinning of hair all over the scalp, and another type of hair loss only affects one specific part of the scalp. A family doctor or dermatologist can work out the right diagnosis by looking carefully at the pattern of hair loss. Alright, so let's talk about what causes this type of hair loss. Male pattern balding is essentially a genetic condition. One study compared identical and non-identical twins and found that 81% of male pattern hair loss is attributable to genetics. Multiple genes on both the mother and father's side can contribute to hair loss, so we can't blame either side completely. So what does this hair loss actually look like at a microscopic level? Well, hair growth goes through specific phases. The first is the growth phase, where our hair follicles create chains of a hard protein called keratin. This growth phase normally lasts anywhere between 2 to 6 years and produces thick hair. Once the hair has matured, it goes through a brief transition to the resting phase, where the hair just hangs around for about 3 months or so. At the end of the resting phase, the hair falls out and the growth cycle begins again. For people who have a genetic tendency for male pattern hair loss, the hair follicles are overly sensitive to a cousin of testosterone called DHT. In balding men, DHT shortens the growth phase of certain hair follicles. Because of this shortened growth phase, hairs that were once long and thick become shorter and thinner because they have less time to grow. This sensitivity to DHT seems to affect some parts of the scalp more than others, resulting in that classic hair loss pattern that we looked at earlier. One of the most common myths is that balding men have more testosterone than other men, and that's why they lose their hair. A related myth is that having sex can lead to hair loss. Neither of these are true. In reality, both balding and non-balding men have similar testosterone levels. It's just that balding men tend to convert more of their testosterone to DHT, and their hair follicles are more sensitive to DHT than non-balding men. But in saying that, we do know that performance-enhancing drugs like anabolic steroids and testosterone absolutely increase the risk of hair loss. This is because they artificially boost androgen hormones in our body.